world is currently witnessing the worst known outbreak of the deadly Ebola virus. The outbreak is centered in West Africa, specifically in Liberia, Sierra Leone, and Guinea, 3 countries which share a lack of infrastructure, a shortage of medical professionals, and a recent history of civil war. With over 5,000 deaths recorded since March this year, scientists are predicting that things are likely to get worse before they get better, unless the world can make an effective intervention. I work for a technology startup called Journey that develops innovative mobile apps for businesses. About a month ago, we set out to answer the question, could a smartphone app assist in the battle against Ebola? We found out soon after that the answer is yes. Right. I'd like to tell you about an app we developed called Ebola Care, how it works, the impact it has in West Africa, as well as the lesson that we've learned when it comes to the issue of donation versus co-creation. Let's start with Philip and Milan's story. Philip and Milan are 2 of my colleagues, and they also happen to be the co-founders of Journey. They recently moved from Cape Town to San Francisco to expand our company's footprint in the US. During their trip over, they were bombarded on news on Ebola, and they started wondering if there wasn't anything they or our company could do to help. Upon their arrival, they were surprised to see how complacent these resource-rich tech giants were toward the virus, and this compelled them to take action. Philip and Milan spoke to an organization called Global Giving, who put them in contact with NGOs already battling the spread of the virus in West Africa. And this is how they met Sam Herring. Sam is the data manager for an NGO called More Than Me. Sam is from Liberia, which means he understands the culture, he speaks the language, he's battling the crisis head on, and he's there to stay. It also means he could give us unique insight on what we can do to help. Between conversations with Sam and other aid organizations, we learned that decisions were being made based on rudimentary data collected from the field. Ideally, the data should tell them what works, where to direct their efforts, as well as how to avoid mistakes. The movement of the Ebola virus is almost invisible. By the time someone's exhibiting symptoms, it's often too late. To make better decisions, information needs to be available quickly and consistently. The problem with paper forms is that they have to physically travel back to a facility where they can be typed into a computer system. It can take days, sometimes weeks, for information to become available, which means decision makers are always playing catch-up. There are other problems too. The data captured is often inaccurate, especially location data. And when forms are updated, which happens frequently, there can be massive delays in getting out new forms to remote teams. Sam told us his biggest priority is getting data from the field faster. Why? Because in order to defeat Ebola, you need to act on information that is accurate, and you need to do so faster than the virus can spread. Let's take a step back and look at where Journey started off. Journey was founded in Cape Town in 2009 and was contacted soon after to develop a mobile app that could replace the ineffective paper-based system that community health workers use to monitor patients in rural areas. The basic functionality of the app was to capture information on patients that had difficulty visiting a brick-and-mortar clinic. This information would include the measurement of their vitals, the distribution of medication, and the scheduling of follow-up visits. The app had to be extremely easy to use, quick to roll out, simple to update, and it had to be able to work offline in remote areas. So we did exactly that. We developed an app that was well suited to the African context, as well as any context where money, time, and infrastructure are in short supply. The app yielded incredible results, and we've since developed many similar apps in the last few years. So what exactly does Ebola Care do for Sam's organization? The app helps to trace persons who may have come into contact with the virus. It monitors households under the 21-day quarantine period. It captures details on orphaned and abandoned children so that appropriate care can be arranged for them. And it helps medical teams to capture vital information on each patient that they transport, assist, or treat. many areas that are affected don't have street names. The app's ability to capture GPS locations and to provide a heat map of the most heavily affected areas is incredibly valuable in understanding the movement of the virus. All information captured is available immediately to decision makers on a secure cloud database. The initiative received massive press interest. In a matter of weeks, we found ourselves being featured on Forbes, CNN, Al Jazeera, CBS, and a myriad of South African publications. We kept encouraging our audience to help us raise funds to make this initiative available to more organizations in West Africa. I'm very excited to say that we managed to raise funding and support to the value of $500,000 in just 2 weeks. We are now in the process of partnering with West African-based organizations so that as many people as possible can have access to the Ebola Care solution. In the next few weeks, we want to enable 1,000 aid workers to respond to the crisis using the Ebola Care app. At this point, I'd like to tell you a bit about my own story. I've always wanted to work on the African continent, especially in the exciting field where technology and development intersect. And I always thought I'd be working for a very large organizations like the United Nations or the Bill and Melinda Gates Foundation or any other similar organization with a lot of influence. But with my work through Journey and Ebola Care, I learned about the power of a small fish with big ideas. Being a small fish forced us to collaborate and co-create a solution. Larger organizations often have difficulty to take the time to collaborate with small local groups. Donation is often the easier thing to do. I'm by no means saying that donation doesn't make a positive impact too. In fact, in the battle against Ebola, West Africa desperately needs the financial support of donors. They need doctors, medical supplies, and pop-up clinics. But there are 2 reasons why being a small fish with big ideas is pretty great. The first one is we are nimble. We can respond to feedback fast, and that is essential for co-creation. Working with a small organization also means that both parties can make decisions very quickly. In just 4 days after speaking to Sam, our Ebola Care solution was deployed in Liberia. During the pilot phase of the app, we kept on constantly updating the app based on feedback that we got from aid workers. And we will continue with this iterative approach throughout the crisis and long after the immediate problems have been solved. This brings me to my second point. Because we can co-create, we can create solutions that last very long, solutions that keep being useful after big NGOs withdraw themselves. We want to keep making the app available to West Africa-based organizations for years to come. And we want to keep adapting the app to each organization's needs and as the community's medical and infrastructural needs change. We learned not to make assumptions about the problem, but to rather speak to the people experiencing the problem and addressing it on the ground. In closing, many of us feel overwhelmed by Africa's developmental challenges. And there's a big debate, what is the right thing to do? What is the right way to get involved? Through Ebola Care, I learned that with co-creation, anyone is welcome, anyone can take part. Anyone can share their talent, knowledge, time, technology, and partner up with someone in a crisis who just desperately needs resources. The world needs more small fish to team up with other small fish, to build relationships, to collaborate, and create long-lasting, sustainable solutions. Thank you.